Dr. T, let's talk about making the face, tightening the skin, and also perhaps, tightening the skin is one thing, but what about putting more life, more color in the face? I mean, there's people that have a nice glowing red kind of like color, and they look healthy versus a little pale. So, what can be done there? Can there be something done?
Yes, there's always hope, as I tell my patients. First of all, if you notice, and this comes from studying people. I've always studied faces, and again, anytime a client comes in, I really study their face. I look how they move, their muscle expressions, to know how best to be able to treat or help them in their areas of concern. A common area, you mentioned this very, very precisely, is a dull complexion. What happens, we have this dead layer called the stratum corneum, and that develops it's a dead skin layer that covers the skin. If you look at a person who's in their 20s, they have a brighter glow than a person who's even in their 30s or 40s or 50s. Well, we can do something, for example, microdermabrasion. Microdermabrasion is a deep cleansing of the skin, removes that dead layer. You're not going to look 5 years younger with one treatment, but those that decide to get a series of treatments, like every week or every 2 weeks, get half a dozen treatments, that by removing that dead layer, the new skin underneath starts to multiply and progress to the surface much more quickly and gives a brighter complexion. That obviously is kind of the first stage or the lowest end of what we can do to help rejuvenate the skin. We have much more powerful treatments. Photofacial, beautiful treatment. I had the pleasure to train with the inventor of the procedure, Dr. Patrick Bitter out of California, and that helps the dyschromia, as we call them, the sun damage, the brown spots, even the fine vessels and the redness that kind of develops in the skin. That is a totally no downtime procedure. A series of treatments every 3 to 4 weeks. You get 3 to 5 treatments, and pore size shrinks, skin looks smoother. If women apply makeup, you find the makeup goes on smoother. You actually need less makeup. All those benefits are from photofacial. It does stimulate some collagen a little bit. That's what gives the smoother skin and the tighter pores. On another level, a little more aggressive to really help more wrinkles is fractional resurfacing. Whether someone uses an erbium or CO2 laser, we call it fractional resurfacing. 20 years ago, women would be put to sleep and get what's called CO2 resurfacing. Would they look better after recovery? Absolutely. They could look 15 years younger. However, it took 3 weeks of oozing, painful face, and sometimes up to 3 months of redness. It was a very aggressive treatment and required general anesthesia. What we have available now is fractional resurfacing. What does that mean? Exactly what it suggests. We resurface the skin, but only a fraction. We leave a lot of normal skin. What this does, it allows collagen stimulation, wrinkle reduction, but because we leave a fair amount of intact, healthy skin, the recovery time is days instead of weeks. And this will allow a tightening, a wrinkle reduction, but all with a much quicker recovery.
Wow. So, you do something like that on a Thursday, on a Friday, you take a good weekend off, and on Monday, you're back to normal. I mean, you're better back to normal. You're good looking. But, you tell people you were in the Caribbeans, and they go, wow, what the Caribbeans is good.
Well, it's a good question. We can actually tailor the intensity of the treatment to the number of days a person is willing to take off. And if we're going to get the real best benefit of wrinkle reduction, we tell people 5 days, 6 days. A week is definitely plenty of time. But those that don't have that, doesn't work in their schedule, we can do less aggressive treatments with a weekend recovery, 3 days, and they'll just need maybe additional treatments of that instead of the more aggressive treatment.
Just do it more often. Just take a month apart or so, go and do another one, something like that.
Exactly.
Okay. Well, wonderful. So, and what you're saying is with this particular treatment, a person really actually, takes off a few years of his face?
With a reasonably aggressive or deeper fracture resurfacing, easily 5 to 10 years.
Wow.
With one treatment.
With one treatment. And what about the maintenance after that? So how long does, we talked about liposuction, that the fat really kind of doesn't come back. We talked about fillers, which might last anything between three months and a year, et cetera, et cetera. What about this one now? How long will that kind of last before you have to do it again?
Well, whether someone gets a single, fairly deep treatment or perhaps 2 or 3 lighter treatments, probably at least a year or more. I think we have to realize that our skin is constantly changing. Collagen loss happens about 1% a year. So what are we doing? When we do these procedures and we stimulate new collagen, we take the collagen level up a notch. But then from then on, it's a constant downward trend gradually. So anywhere from 1 to 2 years would be a good, long-term improvement. Now, does that mean
that's
that after that?
That's pretty good. I mean, that's quite wonderful.
Yeah. To complement their treatment, they should continue with some good skincare. We know that sun damage is an issue. And I'll have some patients that come and tell me they want to improve this or that, and yet they don't want to stop attending, or they don't want to stop being in the sun and not use sunblock. Well, I tell them, it's kind of hard for you to be paying money, helping your skin, and then counteracting that with sun. So sunblock, skincare. We have proper moisturizers, non-soap cleansers, even toner and exfoliants to maintain a youthful complexion. So when you invest in a procedure, you want to continue the investment with regular skincare for a complementary and long-term effect.
Right. Well, again, it's a little bit like dentistry. Yeah, you get your cleanings done, you get your teeth fixed, but you've got to go and do your dental hygiene. And if you don't do it, you just need to go to the dentist an awful lot more often. It doesn't last you so long.
Yes.
It's just that simple. I mean, that's I guess understood. So, and there are probably recommendations you make as the patient walks out after such a procedure, that which creams and which maintenance based on his lifestyle he would need. You probably know all that, and you probably then tell him, do this, do this, do this. Like, for instance, you would tell me, Helmut, you're insane going skiing and never put sunglasses on it, and on average not even sun cream. So you would probably...
A lot of people don't realize that even in the winter, or if they're driving in their vehicle, the sun rays do go through glass. Now, through the front windshield, it's less because of the nature of the glass with being, shatterproof. But through the side glass, it goes through substantially. And we recommend a moisturizer with at least an SPF of 15 in the winter. And certainly I would not put anything less than SPF 50 come summer.
Well, wonderful. We're going to talk more about sun cream, sun damage down the road, but that's good information. Wonderful. As you said, that definitely seems to be hope. Thanks a lot, Dr. D.
Always a pleasure.